so capillaries, when I ask you in, I don't know, a couple of weeks, what's the functional unit in the cardiovascular system? Capillaries. Now, what do I mean by that?
At the arterial end of the capillary, the net filtration pressure is equal to the net hydrostatic pressure minus the net osmotic pressure. The net filtration pressure is 13 millimeters of mercury. This causes fluid to move from the capillary into the interstitial fluid. At the venous end of the capillary, the net filtration pressure is equal to the net hydrostatic pressure minus the net osmotic pressure. The net filtration pressure is minus 7 millimeters of mercury. This causes fluid to move from the interstitial fluid into the capillary. Approximately 9/10 of the fluid that leaves the capillary at its arterial end re-enters the capillary at the venous end. About 1/10 of the fluid passes into the lymphatic capillaries and returns to the bloodstream via the lymphatic system.
There we go. So let's unpack that a little bit. So like I said, the capillaries are the functional unit. The cardiovascular system is a delivery system. That's the whole point. So on this arterial side, we have some pressures involved. The pressure called capillary hydrostatic pressure comes from the heart's systole, and the retraction from the elastic arteries. So that is a bulk pressure going out. So on this arterial end, bulk flow is outward, okay? So bulk flow is out, and that is because hydrostatic pressure is greater than the pressure pulling fluid back in. That pressure pulling fluid back in comes from the things dissolved, so things like electrolytes and things in the plasma. But the number one regulator of osmotic pressure was a blood protein. Anyone remember? Albumin. Nice. So the albumins are too big to leave the capillaries. So they are going to pull fluid back in. But on this arterial side, hydrostatic pressure is greater. And so I have this little, who's going to win? Who's going to win over here? The bigger pressure wins, okay? And it's the same thing in sumo wrestling as it is in blood flow, okay? So blood just goes based on pressure. So we get bulk flow out, so we get drop off. So oxygen, nutrients. As the blood flows through the capillaries, notice we're getting further away from the heart. Blood pressure is going down. So by the time we get to the venous end of a capillary, now we flipped it. Now the greatest pressure on that venule side of the capillary is going to be osmotic pressure. And so we're going to pull those fluids back in, right? So we get drop off, net bulk flow out on that arterial side, drop off, and then we're going to be picking up fluids on that venule side. And so it's a great delivery system. So drop off, pick up, okay? The thing is, it's not a perfect system. So we've got a plus 10 millimeters mercury bulk flow out on that arterial side, and we're picking up, we've got about 7 millimeters of mercury to pick up fluids. Those are not the same, right? So what happens is we get excess fluid out here in the tissues, but that's the job of lymphatic system. So on your picture, all those little green, they always show lymphatic system is green. It's not really green, but that's just the color. The other colors were taken, so they always use green for lymphatic tissue. So think about your lymphatic capillaries and the lymphatic vessels, sort of like a storm drain. So when there's excess fluid, it picks up that fluid and then returns it to the blood supply. And so it's roughly about 3 liters a day that is excess, that is picked up by lymphatic system, and that's our topic next week. All right, so just recapping. So leaving the heart, we have elastic arteries. They are pressure reservoirs responsible for diastolic blood pressure. Then it branches, and then they have more muscle than they have anything else, so thick tunica media, and they are going to be delivering or distributing blood to the major organs. And then they get smaller, and we have arterioles, which are like the on-ramps to the capillary bed. That perfusion of the capillaries is going to be controlled through precapillary sphincters, so the arterioles have sphincters. The other big thing about arterioles, they are number one in regulating blood pressure through vasoconstriction and vasodilation. And then our capillaries are our functional unit of the cardiovascular system, so we get exchange. So we're hanging out the capillaries. Notice they're very thin-walled. They are 1 cell thick, so it is only tunica intima in a capillary. There are 3 different types based on the types of cell junction and permeability. So the most common are going to be continuous capillaries, and that just means the wall is continuous. There's tiny little clefts for exchange, but you can see that they're pretty continuous. So they're least permeable out of the 3, and they're the most common. So muscle, skin. If you remember your nervous system, the brain has a blood-brain barrier, so they'd be continuous capillaries with those little astrocytes would wrap their little hands around the vessels in the brain. Then notice fenestrated. So Fenster, if you speak German, means window. But these have pores, and these are going to be more permeable. These are the type of capillaries that are going to be in organs that are involved in secreting and absorbing things. So small intestine is where we're going to absorb all our nutrients. Kidneys, they're going to filter blood and make urine. They're involved in secreting and absorbing things. Endocrine glands, usually they're going to have fenestrated capillaries. The next ones, you can see sinusoids, so the word sinus is in there. These are going to be the most permeable. You can see this is not a continuous wall. We've got some big open spaces in these capillaries. We're going to find these in glands, organs, sorry, my little things. To cut that out. We're going to find sinusoidal capillaries in organs that have cells that need to move in and out of the bloodstream. So bone marrow is where hematopoiesis occurs. So those newly made blood cells, they can get out through these sinuses and go into circulation. The liver and the spleen are also involved in filtering, but also we have some immune cells involved there. Endocrine glands, some of them that we want a little faster, they can have these open spaces so hormones get into the bloodstream rather quickly. And the adrenal medulla also is going to have these big spaces, so the epinephrine, norepinephrine can get into blood supply quickly. Okay, so they're the most permeable. So continuous, most common, least permeable. Fenestrated is kind of in the middle of the road, and then sinusoids are most permeable. All right, so now we have dropped off oxygen nutrients, we've picked up nitrogen-containing waste, acids, carbon dioxide. So now it's time to go back to the heart. So those capillaries are going to merge and form small vessels going towards the heart. Those are called venules. And then they're going to merge and form medium and large veins. And then we get to the superior and inferior vena cava. They are under the lowest pressure because they're furthest away from the heart. Medically, what we're going to do with our veins is these are places you're going to draw blood. You're going to stick IVs and ports, okay, because it's slower moving. Structurally, because they are so far away from the heart, they're going to have very few elastic fibers needed, and they don't need thick walls to resist pressure, so thin walls. So we're over here on the venule side. They're going to be the smallest. Also, because it's under low pressure, we're going to talk about our immune system. White blood cells, God bless you. When there's an infection or inflammation in the tissues, white blood cells are going to leave the blood supply. They can leave from a venule because it's nice and slow when they're thin and they've got walls they can get through. So that's called diapedesis and chemotaxis. So they, along with the arterioles, they're small enough too, but this is the easiest site for them to get out because they're under the least amount of pressure. So the walls of the veins are too thick. So there's medium-sized veins. Those are the ones, they're going to go from the venules, they're going to start to merge, they get medium-sized, and as we've got our valves. And then in the abdominal cavity, abdominal pelvic cavity, and in the thoracic cavity, then we have our large veins. Remember, they have thin walls, they're going to be collapsible. They have thick lumens, and that is going to help lower resistance so we can get some blood flow back to the heart. Their thickest layer is going to be their outer binding layer, so that tunica externa. And the big thing they have that none of the other vessels have, so think veins, think valves. Okay, and that's going to prevent backflow. because there is low pressure, right, we need some tricks to get the blood back to the heart. And so there's 4 mechanisms of veins to return blood to the heart. One is called the skeletal muscle pump. Veins are going to be sandwiched between skeletal muscles. Your muscle tone, I don't know if you remember this from your muscular system, your muscles do have some tone to them. So like if you feel your muscles, you're not, unless you have flaccid paralysis, you know, some of us have more muscle tone than others, but you have some sort of tone to you, right? And that muscle tone is functioning distally to proximally. Okay, so even when you're at rest, the skeletal muscle pump is helping constrict veins, and because veins, particularly in the appendages, have valves, that blood's going to move basically from one valve space to the next just through compression. When someone is exercising, they're moving more, they need more blood flow, right? Because they need more oxygen, they need to make more ATP, and so our movement facilitates moving blood back to the heart because muscles will be contracting more. Okay, so that's what's meant by the skeletal muscle pump. Respiratory pump has to do with the changing of your respiratory muscles, which is the diaphragm. So the more I'm breathing, the more that muscle is moving. It's going to change the pressures, alternate pressures in the abdominal cavity and the thoracic cavity. So that's going to help move blood back to the heart in those 2 cavities. So the more somebody is exercising, the more blood they need to return to the heart. So that's going to increase what's called venous return. The other thing is veins also do have that tunica media. It's thin, but it is also capable of constriction. So it can also squeeze and move blood from one valve space to the next. And valves are mostly in the limbs below the heart. There's more valves in those vessels, and that is to ensure one-way blood flow. And we watched that video. Just think of a water bottle and think of a water bottle upright. Movement increases venous return. I really need to remember to, but I forget that. I put animations in. All right, the other thing, if you notice on your sheet, is that veins are considered blood reservoirs. And they have high capacitance, which just means there's a lot of them and they can have a high capacity for holding volume. That's just really all they're trying to say. So if you look over here, systemic veins at any one time are going to have 64% of the blood supply. Pulmonary veins also have more than other types of vessels. Okay, so what this means is when somebody needs an increase in cardiac output, like they are exercising, then the veins can constrict and add more blood into circulation. There is differences in vascularity amongst tissues and also amongst people. The extent of vessels has to do with how metabolically active is that particular type of tissue. So skeletal muscle, right, brain, heart, liver, these are all very metabolically active tissues. They're going to have a very rich blood supply. When you learned about tissues and other things in AP1, you probably learned that some things are avascular, so A means without vascularity. They don't have a blood supply, or very minimal. So tendons, ligaments, epithelial tissue, cartilage, cornea, which is the lens of the eye. The body can go through a process called angiogenesis. Genesis always means the beginning of or the production of, and angio means vessel. If somebody is athletic, moves around a lot, that puts their muscles under oxygen demand, the body will make more blood vessels to deliver blood to those tissues. Adipose tissue, as people gain weight, that's still tissue that needs to get fed, so then those vessels have to feed that fat tissue. We learned about the coronary blood supply going to the heart, that in response, there can be more coronary vessels. So it's the use it or lose it principle. So that's why, don't stop moving. If you don't want to age, just keep moving. That's the key. I'm going to just hold on to that. As people age, though, they tend to become more sedentary. The body is not going to maintain tissue that's not being used. Okay, so you can also get regression. And so skeletal muscle after an individual becomes sedentary. Also, though, too, when somebody loses weight, then they will have less blood vessels because they have less tissue. And so it just kind of makes sense. Use it or lose it.